THCV doesn't really come with the head high when consumed orally or sublingually, but they did a study where they combined THCV and CBD, and they gave it to patients over 90 days. I think I have, yeah. So they actually had two test groups. So they did THCV and CBD sublingually. The first group had 8 milligrams of THCV, and the second one had 10 milligrams of CBD. And the patients lost an average of about 5.7 pounds. And then they had a second group that got a little bit more, where they got 16 milligrams of THCV and 20 milligrams of CBD. And that's a typo there, but the patients actually lost 9 pounds in 90 days. But what was interesting with that group, with both groups, the THCV and the CBD group, both groups got the THCV and CBD, but what they found is that not only did they lose a significant amount of weight, but it also decreased abdominal girth, their systolic blood pressure, and also their total LDL, their total cholesterol and their LDL cholesterol. So if we think about this, now we've looked at THCV and we've talked about this before, concerning blood glucose levels and how it seems to help with type 2 diabetes and metabolic syndrome. But if we start looking at this combination of THCV and CBD, I mean, I see a path forward where this is starting to be, maybe first line therapy for patients at risk for cardiovascular disease or type 2 diabetes. A very fascinating study, and our Facebook post got a lot attention on that, and we got a lot of feedback on the newsletter as well. Jasmine, it looks like you have a question. Go ahead. What was your question?
So it's not really a question, it's more of a comment on the whole diabetes thing.
Yeah.
So I used to be like super in like the type 2 diabetes range, and then with starting getting my card, it actually helped me lose weight, and now my A1C is like in the 5.2.
Excellent.
And I was like, and that was like an instant change from when we started using marijuana, and my primary healthcare doctor is like amazed by it.
Yeah, that's actually pretty common. And again, I dropped 170 pounds and I was like, what's going on? Because I've always tried to do that. And, with a blood pressure problem and pre-diabetic. And even my wife, she dropped 80 pounds. And we had one patient down in the Altoona area that dropped 225 pounds. I mean, and that's just using cannabis. And the cool thing about these cannabinoids is it provides a sustainable weight loss. So you lose that weight, your body's working better with the sugars and the fat storage, and it stays off. Where listen, whatever is good for you, but these folks that are getting Ozempic and paying $1,000 a month or whatever for it, and they look horrible, and when they stop using it, boom, right back. I know that was my struggle throughout life was, try a diet, try a drug, and I've tried them all. The only thing I never did to lose weight was weight loss surgery, gastric bypass. I never did that. But right before I started cannabis medically, I was over 360 pounds. And I mean, that's how I was most of my life. High blood pressure since I was 18 on a bunch of medications, high cholesterol, all of that. And when I started using cannabis, I mean, I was blown away.
Just a little side note, Ron mentioned TivaFit, and then we talked about that THCV and CBD combo in the literature, and that's exactly what we put in the TivaFit. So we were kind of ahead of the research on that one, whether luckily or just because we were kind of reading the tea leaves that they came through.